Hello and welcome, it's Chris from Christopher Hall Training, and welcome to this week's tutorial where we're going to be answering the question, what should you do if you get episodes of back pain a couple times a year? Now this is a common type of back pain that people get. I work with a lot of people that get this. They say they don't have lower back pain, but it just comes a couple of times a year. So in some respects they do have lower back pain, and in a sense the whole year is contributing to their back pain. What we've got to be able to do is what we're going to talk about in this tutorial, where we're going to be talking about sort of what that type of back pain is, what can be some probable causes, and what kind of things do you need to be thinking about and need to be doing in order to overcome that type of lower back pain. And in the coming weeks I'll talk more about different types of back pain, but for now it's just episodes of lower back pain that you might get a couple of times a year. But before we get into that, just quickly want to mention, you can see up in the top right hand corner my social media on Twitter, Facebook, Instagram and YouTube. So please do, if you're on YouTube, subscribe to the channel. Pop any comments below, any questions that you might have about the content, anything that you found interesting or something that you might have learned about this tutorial. Alternatively, come to Facebook, like the page. I'm always sharing more on my channel, more tutorials. And alternatively, if you look at the bottom of the screen, you can go to the URL there, which is in the description, which goes straight through to my newsletter, where you just pop your name and email address in, and then I'll be sending you my monthly newsletter, which contains exclusive tutorials based on lower back pain, core strength and posture. On that newsletter as well is relevant recent content and relevant exercises that you can start doing to help your core, your back pain and your posture. So if that sounds like something that's interesting to you, pop down to the link in the description, click through. It'd be great to have you on board. And again, if you have any questions about any of those, please don't hesitate to ask. But for now, we'll get back to today's topic, which is what do you do if you get episodes of back pain a couple of times a year? So what are we talking about here? Well, what is an episodic low back pain? Well, it's longer periods of no pain followed by short periods of pain, and in some respects like a rehabilitation process, be that whatever your rehabilitation process is, be it rest or seeing a chiropractor or physical therapist or whoever it might be. But essentially you have long periods of no pain followed by short periods of pain. So that's the type of back pain that we're talking about. So what could it be? Well, it could be a disc. It could be a herniated disc, it could be a bulging disc that only irritates the nerve a couple of times a year. It could be a nerve being irritated by some tissue. It could be compression around the spine. It could be muscle fatigue around the spine, and then the back or the muscle goes into spasm to protect the spine because the muscles are fatigued. So that doesn't mean to say it's all of those. That I'm not trying to say it is your disc, it is an irritated nerve, or it is muscle fatigue. Those are things that it could be. So a part of your journey is to, in a sense, find out what it is. And then what can you do about it? Well, it's most important to identify postures, movements and loads that trigger the pain, and then avoid, reduce and adapt them. So it's useful to keep a journal. So when you are going about your day-to-day life and then all of a sudden you get an episode of back pain, think about what have you been doing during the days or weeks leading up to that. Some people that I see with back pain like this, they were moving house, for example, and then their back was aching during that time. Or they were going through an increase in their training for their sport, or they were playing more sport or going to the gym more for a period of time. So you can start to identify that it was those postures, those movements, the loads that they were using, i.e. the increase in training. So you can start to identify, okay, well, this is what might have brought on my lower back pain. If you then keep a journal, you can then start to find patterns in your back pain. You may be able to do that now just by thinking back at it. So it's very much looking at what was happening in the preceding days, weeks, and possibly months leading to your lower back pain. It could just be that you're sat for long periods of time in the office or in a car, whatever it might be, and every 3 to 6 months you get back pain. So it could just be a lifestyle habit that is causing your lower back pain. If it's a common occurrence and there's no real different activity that you're doing, i.e. moving house because you're lifting boxes, you're tidying up, you're then unloading boxes in the new house, so on and so forth. So it's very much trying to identify what are the postures, what are the movements, what are the loads that trigger the pain. So what you can then do is, if it's something that you can avoid it. If it's something you can't avoid, either reduce it or adapt it. So it could be changing how you lift. If it's because of sitting, obviously we can't avoid sitting, so can we reduce it? Can we get up every hour for 10 minutes, just walk around the office or walk around the house? Or can we, during our lunch break, can we go out and go for a 10-minute walk? Could we go for a 10-minute walk in the morning, 10 minutes in the 10 minutes at lunchtime, and then 10 minutes in the afternoon, evening after work? To again try and reduce the stress to the spine and give it some degree of therapy during the day. If we can do that, what we might do is we might stop it happening every 3 months and then move that out to every 6 months. Or if it's every 6 months, move it out to once a year. If it's once a year, can we move it out to once every couple of years? And then eventually what we can start to think is, can I then move that and just keep moving it back once every 5 years, once every 10 years, so on and so forth? If we can do that, we can start to identify that we are improving the robustness of our core. The final thing is join my newsletter. So please do click the link in the description, and what you'll receive is relevant content to build core strength, to overcome lower back pain, and to improve posture. You'll get those in the newsletter. So what you can start doing is, just like this tutorial, you can start using it on a monthly basis to be able to improve the health of your core and improve the health of your spine, because there will be action steps that you can start taking in the next month to be able to improve the health of your back, improve the health of your spine, build core strength, and improve your posture. So where it is something simple and you will have to apply it, it will start you on that journey to building a better body so you can experience less in the way of aches and pains and more in the way of a healthy spine, back, core, and posture. So hopefully this has been helpful. Hopefully it's given you a better idea of certain things that you need to think about, because I haven't gone into certain exercises because in some respects it doesn't need exercises. Sometimes simple lifestyle choices and just having a better education around the health of your back can help. So start here, and then what you'll be able to do is then layer exercises on top. And if you join the newsletter, you'll start to get some of those exercises. So many thanks for watching. My name is Chris from Christopher Holt Training. I'll speak to you in the next tutorial.